So the last part of this module or this discussion is I want to look at the different hormonal profiles itself. So we're going to look at what we consider the primary anabolic hormones that are within manipulation of our exercise environment. We're going to look at the primary catabolic hormones, and then in our next unit, when we get into nutrition, we'll talk more about the hormones related to metabolism. But for the most part, these are the primary anabolic hormones: testosterone, growth hormone, and insulin. And I just do want to point out, and we'll talk about the sex and age-related differences, that testosterone levels are about 20 times higher in men than are in women. When we look at growth hormone, it can be up to twice higher, 100 to 200%. And so when we talk about sex-specific, testosterone is going to be the hormone we're going to try to maximize in men, and only men. But growth hormone we're going to try to maximize in both, particularly with your female clients. You have insulin-like growth factors that are a byproduct of that, and then what we won't talk about so much in this, but we'll get into just an introduction, and then more in the metabolism is we'll look at insulin and looking at the optimization of insulin. Because when we look at the most anabolic hormone to muscle, insulin is the number one. It's the most anabolic hormone, but it's also anabolic to fat tissue, and so we don't want that. So we start with testosterone, and remember it's a steroid-based hormone, and it has its effect on the 6 things you see here: on skin, on brain, male sex organs. So it is the primary hormone that differentiates the male from the female in all species. The default form on the planet Earth is the female form, at least with humans. I'm sure there's mammals that break that, but for the most part, for men or for humans, if you were to castrate an animal early, or castrate a male, which hopefully never do that, although his chromosomes would be that of a male, he would look like a female. They would get female developmental, like the shoulder girdle wouldn't grow, and so you wouldn't get the facial hair or the disproportional growth of the shoulder girdle. So it's the testosterone that does that, and testosterone has its biggest effect on bone and muscle, with its biggest effect on muscle tissue itself. So this is what really separates the size differential between men and women, and the strength differential between men and women, particularly in the upper body. So if you were to look at the testosterone levels versus men versus women, you can see that women's testosterone levels are virtually nothing. And what this graph is actually looking at is looking at the diurnal effect, so the daytime effect of testosterone, and you'll see that men's testosterone levels typically peak afternoon, so like 2 or 3 o'clock. Not this makes a big deal, but if you were going to try to like really zero in on your training, and this is assuming you go to bed at 10 o'clock at night and you're up at like 5 or 6 a.m., so you're really protecting that time aspect, and that you're also assuming that your nutritional and your sympathetic systems are under check and your parasympathetics are dominated, that your testosterone levels are peaked around 2 or 3. So if you were going to work out, that would be the time that you work out for, again, 70-80% of the population. But you can see that for women, it doesn't matter because testosterone levels are so low. Now, it doesn't mean that women still can't benefit from strength training or from testosterone, because they do have a little bit of testosterone, but it's just not enough. It's insignificant. It's shadowed by the growth hormone effect, and so trying to optimize testosterone in a female, there's a small percentage of the female population that has naturally high testosterone levels, and so in that population you may want to, but that is the exception, not the norm. But the testosterone is the primary androgen that affects the muscle tissue, and we're looking at strategies how we can maximize that in athletes. But if you look at the free testosterone, which is usually considered the most effective in the effect of lean body mass or muscle tissue, you can see the testosterone levels that happen from training just within a single workout. And you can see pre-testosterone levels, mid, and immediately. IP stands for immediately post. And you can see that towards the end of the workout, you can see that men's testosterone levels almost doubled. And women's basically didn't change, right? So again, they were still monitoring some testosterone was there, but you had almost a 5 times increase in testosterone just at rest there itself. Now remember, total testosterone levels aren't as important as the receptor sensitivity. So it's not just is the testosterone levels elevated, it's are the receptors turned on? And that's one of the key things that happens, is that yes, you can see here that you get an increase in testosterone. So at the beginning of workout, you have like about 30 millimoles per liter, nanomoles per liter, and then immediately post, you peak about 40. So you're only increasing by like 10 points, right? But what's really happening behind the scenes is that the receptors of, and only those tissues that were metabolically active, so muscles that were acting glycolytic because of the high intensity training, those receptors turned on. And so that's one of the key aspects, is that men have testosterone floating through their blood all the time, right? There's other parts of the body that it's beneficial to and what for, but for particularly muscle growth, it only will transcribe proteins and go through muscle hypertrophy if those receptors are activated. And the way you activate those receptors is through exercise variables. You use large muscle groups, so like performing deadlifts and squats, so compound exercises. So doing leg curls and bicep curls really aren't going to elicit a response from that. Like, these are big muscle groups. Heavy resistance, so you're looking at exercise 85-95% 1 RM. That's like things you can do 8 times or less, so 6 to 8 rep range, 2 to 3 rep range probably better. High volume of exercise, so you're doing at least 12 to 15 sets per workout. Now 10 to 12 sets per like working set, and you're doing short rest intervals, so like 60 to 90 seconds, 30 to 60 seconds for that. And the more time, more experience you have, the more effect, the profound effect you have with testosterone. And what's happening, as we'll talk about, is your training age. Are you a beginner, intermediate, or expert? This has changed your hormonal environment for you to respond more favorable to lean body mass and fat mass. So cortisol has less of an effect with conditioned athletes, and testosterone has more of an effect. And that's one of the goals of being consistent with your exercise and training. So the next hormone we look at is growth hormone. And growth hormone, as I said, is the most anabolic hormone to lean body mass for women. And it's the one we want to maximize as much. And it's also a huge benefit for men, and so it's one we want to maximize as well in both sexes. But you can see here that it does a lot of stuff, right? And as I said in the live session, the growth hormone was considered like the fountain of youth, because I mean, if you look here, like body fat, bone density, sexual function, immune function, like skin and hair, collagen production. I mean, this is like the anti-aging hormone. And it comes out of the pituitary gland, and you can see it has an effect on bone, muscle, and liver, and particularly fat for lipolysis, breaking it down. You can also see here that it has an effect on increasing the browning. It increases the mitochondria in that. So if you have a healthy, optimized growth hormone, you're going to have a better quality fat tissue, if you will. But you can also see here that it has this IGF-1 release, and you can see that the way that this growth hormone works is that it doesn't actually work on the muscle and liver bone directly. What it does is it has a preventative effect of catabolism in the tissue, so it stops bone breakdown, stops muscle breakdown. But in its feedback mechanism to suppress growth hormone, this IGF-1, these insulin-like growth factors, these are the things that actually increase muscle growth. So these are the things that you're trying to maximize, but it's triggered by the growth hormone itself. You can also see insulin superimposed here, and you can see insulin kind of has as a competing effect with it. Whereas insulin turns on fat storage, growth hormone turns on lipolysis, or the opposite. So they kind of work in conjunction. And so if you were to optimize the balance or the tug of war, your growth hormone is the agonist, your insulin is the antagonist, and so you would want to maximize growth hormone and minimize insulin. But you can see that insulin and IGF-1, insulin-like growth factors, they have similar effects. That's where the name comes from, these growth factors, but these are usually triggered as a stopping mechanism to prevent or suppress growth hormone. But in order for this to happen in the first place, you had to have optimal growth hormone, and growth hormone is one of those things that is sensitive to the total amount of stress, your amount of fitness, like how fit you are, your recovery, your diet, things that you can't control like age, gender, but you can see all these other things here are lifestyle factors. So growth hormone is one of those hormones that are very sensitized. If you're going to maximize growth hormone output through high intensity exercise, but you're really going to maximize growth hormone through your sleep, through your diet, and through your stress management. So it's purely, truly a lifestyle hormone, right? But it's a drug. Again, here you can kind of see the balance that exists between the gluconeogenesis and the lipolysis and the counter effects of insulin. So if insulin if you control insulin, you control fat storage. Then if you can optimize growth hormone, you can optimize fat burning. And so it's a growth hormone you want to optimize in insulin, and you can do this independent of exercise. So again, just through appropriate lifestyle and choices, you can maximize your fat burning environment and preserve your lean body mass. The next hormones we look at here are insulin and glucagon, and I include these here because, again, it's just planting the seed for our conversation. We look at metabolism, but insulin and glucagon are primarily related to blood sugar levels. And so when you have a rise in blood sugar level, your body releases insulin. It needs to get sugar out of the blood into the cells, liver first, muscle second, and then fat third. You have a limited storage of sugar as glycogen, and you have an unlimited storage of fat. Blood sugar is elevated through carbohydrate intake. Highly sensitive to carbohydrate intake, doesn't matter if it's complex or simple. And it's also sensitive to protein intake, because when you eat protein, your body releases this hormone called glucagon, and glucagon helps to break down those amino acids so they can store. The problem is that when it breaks down the amino acids, it also raises blood sugar level, and so your body also produces insulin at the same time to bring your blood sugar levels down. So protein is also insulin producing. The only macronutrient that doesn't really have that much of effect on insulin, unless it's a huge large meal like you ate a stick of butter, is fat. And so fat doesn't have this effect on blood sugar levels, and the body doesn't really care if your triglyceride levels are 30 or 300. But if your blood sugar level is elevated, that's a metabolic emergency. And that's why I showed that slide earlier where it looked at when insulin is reacting to the cell and the receptor of fat and muscle and so forth, particular fat, it's intake only. It doesn't need any excess energy. And this is what we talked about in the oxidative state in the last module, that your body can either metabolize sugar or metabolize fat oxidatively. The way this is always presented is that the body preferentially burns sugar over fat, and it's not that it prefers, it's obligated to do that, because elevated blood sugar levels is a medical emergency to the body. It prefers ketones and fats, but it can't if sugar levels are elevated. And that's what has caused this obesity aspect. And then what's really interesting, that's outside the scope of this, but just fascinating, is that when your body is sugar adapted and not fat adapted, your fat actually starts to favor a sugar environment and favors insulin and fat storage, and and it starts producing hormones for you to be more. It's fascinating how everything's interlinked, and it just takes one swift kick to break that cycle, and then the whole house of cards falls down, and you get back into this optimal metabolic state. So it's easy to do once you know the right things to do, and that's where you'll be spending lots of your time with your clients, is helping manipulate the hormonal environment. And yet you're not an endocrinologist, and you're not doing it through drugs. You're doing it through education, exercise, and lifestyle changes. So you can see here the effect of insulin. It increases muscle glycolysis, so increase the breakdown of sugar within the muscle for fuel production, increases protein synthesis because it's storing there. But it has this negative effect on the lipolysis. It stops any fat burning from happening. So anytime insulin level is elevated, fat burning comes to a halt, and your body shifts from ketones and fat economy to a sugar burning economy. And so that's the effect of insulin, and you kind of see through this. And like I said, we'll talk more about this in the digestion and metabolism. We'll look at carbohydrate. So then we move on to our primary catabolic hormones, and these are your coming from your adrenal glands, and this is cortisol, which is also a steroid, and your catecholamines, which are your amines or peptide-based hormones. So here's cortisol, and it has when you look at this initially, you'll look here at the top here that it promotes the breakdown of fat, which is a good thing, and cortisol is a good thing. There's no such thing as good or bad hormones. Insulin is a good thing. Glucagon is a good thing. Testosterone is a great thing, a good thing. But it's all about optimization. Are you acutely exposed to that hormone, or are you chronically exposed to your hormone? And you probably have heard of cortisol, besides insulin, being associated as your stress hormone and being associated with fat gain. And it is because what cortisol does is it does promote breakdown of fat acutely in short situations, but it also can break down muscle tissue, and in long-term play it can inhibit fat breakdown, and so it starts to favor proteins. And so when we talked about last unit that amino acids aren't normally used as a macronutrient, they can be when exercise is prolonged 2 to 3 hours. That's because cortisol levels have risen so high and growth hormone levels are basically pooped out, that the growth hormone is no longer protecting muscle tissue, and your body's breaking down muscle tissue. So cortisol is the mechanism. So the only time you kind of use amino acids is when you have prolonged stress situations like starvation or prolonged exercise, or trauma like burns or dehydration or injury, something like that. But cortisol as I said, has a catabolic effect. It converts amino acids into carbohydrates. It is brought on the same way you elicit testosterone. So big muscle groups, short rest periods. And so it's one of those, you can't have one without the other. In order to release testosterone, you're also going to release cortisol. It's just part of the game. But as I said earlier, what happens is your body becomes more sensitive to testosterone over time, and you actually become more resistant to cortisol over time, as long as it's an acute aspect. So as long as you're getting appropriate sympathetic response, so the fight or flight response, and you're getting appropriate parasympathetic recovery, your body, cortisol doesn't have a disastrous effect. And the more you actually train and the more you spend time in the glycolytic system, your body doesn't break down muscle. Your muscles actually become resistant to the effect of cortisol. And so then cortisol actually becomes a beneficial thing because it is catabolic to fat tissue. So it's one of those hormones that we optimize, but it happens over time as long as we have enough recovery and rest in between our training sessions. So when we look at the adrenals as a stress hormone, we have the fight or flight response that's activated by true threats, so like anxiety or pain, injury, trauma. You can have dehydration, hypoglycemia, so decreased sugar function, or changes in temperature. So anything that threatens the survival of the organism, and this can be both physical or mental/emotional. And this is all regulated by the sympathetic nervous system, right? That's the fight or flight aspect. And you can see here that you have two pathways. You have the adrenal gland, that's just going to release the epinephrine and the cortisol. You're also going to have the nervous system that's going to be directly releasing it, the nerve directly releasing into the bloodstream, and that's norepinephrine. So you have two different aspects here that are happening to communicate, but either way it has that effect of increased heart rate, decreased digestion, increased sugar output, and then for long term, making sure amino acids are available for that. So again, you have a normal stress response, which you see here on the left, and then as you have chronic, or you start to get negative feedback loops where you're not getting enough time in the parasympathetic, these systems start to become hardwired and they start to become problematic. And so that's why cortisol gets a bad rap as being a stress hormone. It's good, it's an anti-inflammatory early on, but it can be pro-inflammatory if it's there for too long, right? And so it's one of those things that it needs to be the Goldilocks principle, not too little, not too much. And again, it gets into this acute versus chronic stress that acutely, cortisol is an anti-inflammatory, but chronically it becomes a pro-inflammatory component. Just like your fat tissue. In a lean state, healthy state, the adipocytes are actually producing anti-inflammatory components. They actually assist and help the immune system. In a chronically overfed state, when they're growing and it's so much going on, they actually shift from pro-inflammatory or anti-inflammatory to pro-inflammatory, where it becomes more of a negative consequence. And cortisol does that same thing, and it's as simple as the things that maximize growth hormone, sleep, diet, lifestyle, stress, are the same things that suppress and optimize cortisol. So it's not like you have to do a strategy for growth hormone, a strategy for cortisol, and a strategy for testosterone. It's all the same shit. You're just appreciating the different effects from it, and you are aware of it so that you can optimize those and be aware of, hey, you know what, I didn't get enough sleep last night, so maybe I'm not going to try to do 15 minutes on the stair climber, right? You can kind of pick and choose your stress management so you can optimize or recover, or maybe you skip a training day, or hey, I'm going to eat something different, so you kind of play around with it as long as you're aware of how all these things are affecting. And that's really what's happening, is you got this control cycle here of stress, and you have an effect, you have a response, and then you have an adaptation. And so it's just a cycle that goes on, and we'll talk about adaptation later, but as long as the load is followed by recovery, and you eventually have a linear progression over time. And so the 1 step back, 2 step forward, 1 step back, 2 step forward, as long as the recovery comes after the load and you're getting appropriate recovery, you're fine, right? This is exactly what we need in order to get bigger, faster, stronger, and more resistant. And this is coming into the general adaptation syndrome. And like I said, we'll talk way more about this in the next unit when we look at adaptations to training. But basically, you have homeostasis. You have some set of stress, whether it's physical, emotional, psychological, thermal, environmental, and your body then is depleted of resources, and that's the load. Then as long as you have enough recovery, you get into the resistance phase, and your body is recuperated and then some. And then if you're not exposed to that stress again, your body goes back down to homeostasis. And let's say you were injured and you're out for a while, you actually decrease your homeostasis. But as we'll talk about in the next module, and we'll look here is that you can see that your work capacity here, this dashed line, this actually gets higher each time. And as long as you time it perfectly or time it appropriately, where you have a load, 1 step back, 2 steps forward, and then you do a load again, and then 1 step back, 2 steps forward, a load, you'll get more tolerant of stress as time goes on. And then when you get way over here, like 1 year into your training, now testosterone has a more positive effect. Cortisol has less of a negative effect. Insulin is optimized, and your body's not producing as much of it. And your obese adipocytes have turned more back into lean adipocytes, and your hunger is regulated better, and your body's able to adjust into ketogenesis and use ketones for fuel and sugar, and so things become better. And people always misconstrue that you lose fat or lose weight to get healthy, and really it's opposite. You actually get healthy and you end up losing weight because your systems are normalized. And we look at our hormonal output here, and this graph is really cool because it kind of shows you that over a 24-hour or 48-hour period. And we look at, in the last unit, we looked at EPOC, the exercise post-oxygen consumption, looking at the replenishment of the oxygen debt that you created. But it's basically driven by hormones, right? When you look at your exercise period here for high-intensity exercise, you can see that growth hormone, the one that is the granddaddy for preserving lean body mass and mobilizing fat, that's your primary stress response. But you can see very soon if that stress is long-term, it is overshadowed, it drops down to near nothing, and your cortisol ends up being the dominant hormone. And if you could time it perfectly where you stopped like right about here, you could ride your growth hormone wave out where cortisol is down low. And so understanding how the hormones respond and how things are going, this drives the basis for how you schedule exercise. Are you doing 90-minute training sessions, or are you doing 15-minute training sessions? Are you doing high intensity with short rest breaks, or are you spending 90 minutes in the gym with like 2 to 3 minute rest breaks in between? Well, you're probably not doing anything except for increasing cortisol, and you're not really getting the growth hormone response that you want, or maximizing testosterone. So remember this graph here, this is the percent energy being used, and it's showing that at higher intensity activities you're using glycogen for fuel. So guess what? You need hormones that are going to break down glycogen into sugar. And way out here, you're using fat for fuel. Well, that's because your body is producing hormones that are breaking fat for fuel. And you have hormones here that are helping with the creatine. So you have chemical messengers all over the place that are helping to produce substrate. Well, if you took this graph here and you superimposed here at the glycolytic system, you are using sugar for fuel. This is because you are doing activity that you can only do for 30 to 40 seconds at a time. So this is really high intensity activity. And you're using a little bit of fat here. If you can take this and superimpose your hormonal response and look at your high intensity activity here. And so you can see testosterone has that peak like post workout 30, 45 minutes in, and then it kind of goes back down. And as I showed earlier, you can look at the different effects that your primary stress response is your body needs to produce more sugar for fuel. So you need energy, right? Exercise is a stress. It's a sympathetic driven mechanism. It's how you stimulate the sympathetic system, right? You create a hypoglycemic, a high energy, low oxygen environment where your body has to shift to a higher fuel source. And that shift is a stressful response, and you are taking advantage. Your epinephrine levels are up, your adrenals are up. And what happens initially, the first hormone out the gate here is growth hormone. You can see that it spikes right away. It's like a fire hose. It's squirting out like crazy. But as fast as it rises, it drops down just as fast. And you can see here that cortisol, it also is starting to become released as time goes on, but it's a little slower start, and it's kind of ramping up, and then boom, it hits this trajectory where it becomes the dominant hormone for prolonged activity. And like I said, when you get into exercise that's like longer than 2 hours, 2.5 hours, cortisol is a dominant hormone, and it's breaking down amino acids, breaking down fat. So if your workouts are less than 60 minutes, you're not really at risk of breaking down any protein for fuel. But if your goal is fat loss, you're going to want to stop exercise like about 15 or 20 minutes in. And this is the beauty or the the success of CrossFit is that they've done these super high intensity, like 90-95% max intervals, high intensity type stuff. It doesn't matter what you're doing, you're just forcing the body to burn through sugar as quickly as possible. And that's creating a extreme testosterone and growth hormone because you're using big muscle groups, right? I don't think there's a lot of CrossFit activities that are doing single curls or toe raises or lateral raises. They're doing like Olympic lifts and squats and deadlifts and push-ups, and they're also doing high intensities, like do this for 60 seconds and do it to failure, right? So if you're doing 60 seconds and you're doing it to failure, well, look at you, you're glycolytic, right? A lot of times you're doing 10 reps to failure, or 5 reps to failure. You're linking them together where so either way, you're rapidly burning through a lot of energy as quickly as possible. You're draining the glycolytic system, the stored glycogen, so you're increasing reservoir. You're making yourself super hypersensitive to insulin and glucose, and growth hormone is the dominant hormone. And then you stop, right? CrossFit workouts don't last for longer than 30 minutes. And so now you ride that wave out. And so again, this may or may not be their intention, but it's what's happening. You're getting this. And then you get places like Orange Theory Fitness that kind of had this similar aspect. They're trying to have you do high intensity exercise, but they're having you do it for like 45 to 90 minutes. And that's not scientific. If they were stopping, if Orange Theory had it like where you're doing for 20 minutes, 30 minutes, boy, that would be the secret sauce right there. But again, if your goal is optimizing fat loss, you're right there. Now, if your goal is muscle gain, you might want to get more of that testosterone release, or maybe later on. But working out for 90 minutes, an hour at a time, 2 hours. I meant to say 100 minutes. That's way too long. Again, this is the loading aspect of it. Don't forget we also have the recovery, and recovery is huge in terms of sleep is the number one aspect for maximizing parasympathetic and growth hormone production. Nutrition in terms of manipulating your environment so that you can get into ketogenesis and that you're keeping insulin levels under control, your mental and psychological state, and your injury, which like you can't help but getting injury from acute injury, but we're looking more at chronic. So are you in a pro-inflammatory state? Are you taking things, eating things, doing things that are pro-inflammatory where you should be in an anti-inflammatory, looking at chronic injury, not acute? And so these are all things that we talk about in the future, but just realize that it's not just how you manipulate exercise. That's the load aspect, that recovery is just as important.